السلام عليكم ورحمة الله وبركاته. معك الطالب ريان عبد الله مطروف سنة ثالثة كلية الطب. Today I'm going to be performing the general examination of the hematological system. So first, I will greet the patient and introduce myself. Can I have your full name, age, and occupation? Okay, perfect. So, do you have your consent to start? Okay, so I will just wash my hands, of course. I will ask for the exposure to expose the area and proper position. So first, I will inspect the area. I notice that there is a normal body build, there is no jaundice, there is no pallor, there is no bruises like ecchymosis or purpura, and no petechiae. Then, can you please put out your hands? So looking at the nails, I notice that there is no peripheral cyanosis, there is no pallor in the nail bed, and there is no cholynychia. Can you please flip your hands? I notice that there is also no pallor in the palmar creases. Then looking at the eyes, can you please look upwards? I notice that there is no conjunctival pallor. Can you please look downwards? I can notice that there is no scleral jaundice. Then can you please open your mouth? Looking inside the mouth, I notice that there is no ulcers, there is no oral thrush, and there is no swollen, tender or red gums. And can you please put out your tongue? There is no red or smooth tongue. After that, I'll move on to the legs. I notice that there's no bruises, no scratch marks, no edema, and no petechiae in the legs. So this is the inspection. Moving on to the palpation, I'll first palpate the liver, starting from the right iliac fossa. I will ask the patient to take a deep breath, and as he inspirates, I will palpate. So please take a deep breath. Take a deep breath. And as I palpate, I'll move upwards. Take a deep breath, take a deep breath, take a deep breath. So this is for the liver. Then moving on to the spleen, I will also start from the right lower quadrant and ask the patient to take a deep breath as I palpate, moving to the left side. So can you please take a deep breath, deep breaths, deep breaths, deep breaths, deep breaths, and deep breaths. So this is for the spleen. Then the para-aortic lymph nodes. I will start from the umbilicus, move 1 centimeter upwards and 1 centimeter to the right and the left. So palpating like this. This is for the para-aortic. Then for the epitrochlear lymph nodes, this mannequin doesn't have hands, so we will do it. This is the area for the epitrochlear lymph nodes. Usually you would use these fingers and palpate like this. So this is for the epitrochlear. Moving to the cervical lymph nodes, we will palpate the cervical groups. So starting with the submental, and the submandibular, and the preauricular, and the postauricular. This is preauricular and postauricular. Then the occipital, then the posterior triangle, and then the internal or the jugular chain, and then from the clavicle upward the supraclavicular. And I will also palpate the axillary lymph nodes as well as the popliteal and the inguinal lymph nodes. After that, I'll move on to the bony tenderness. I will lightly hit the patient on the spine to check for any tenderness. So just let me know if you have any pain. So spine. So this is for the spine, and then for the sternum and the clavicle, I will lightly press with my fingers. Just let me know if there's tenderness. And then the clavicles on that side. So that's it for the general examination, and thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mohammed Galaf. I'm a 3rd year medical student. Inshallah, today I'll be performing an ear examination, which will include me looking at your ear and inspecting it with the otoscope and also doing some special tests if that's fine with you. I'll start by washing my hands and having a general look at the ear. I can see that there is no sinuses, no swelling and no scars, and also I can see that there's no lumps, and I can also see that there's no hearing aids and no wax covering the external ear. And I'll be looking behind the ear for any swelling and also for the postauricular lymph nodes. And moving on, I'll be checking for the pinna and also the tragus for any pain. And now I'll be moving on to the otoscope. I'll be turning it on, checking if the light works, and putting the specula on. Okay. And pulling the patient's ear upwards and backwards, and putting it inside. And checking for the normal canal skin color. It's normal, and I can see that there is normal distribution of wax and hair. And I can also see that there's no swelling and no pus. And now moving on to the tympanic membrane, I can see that it's pearly gray. It's normal, and there is no perforation, there is no effusion, and there is no pus. And that's it for the otoscope. And now moving on to the special tests. I'll be whispering behind the patient. Since the patient only has the right ear, I'll be covering their left ear, and I'll be whispering and telling the patient to repeat the words that the numbers that I say. 5, 4, 5, 4, 8. Okay. And now moving on to the Renee test. Please tell me when it stops. Can you still hear it? Okay. And now moving on to the Weber test. Please tell me if you can hear it in one ear more than the other, or if they're both in the same, or if they're the same in both ears. Okay, and that concludes our examination.
Assalamu alaikum, my name is Hassan, a medical student. I was asked to perform physical examination. You allow me. The examination will include me touching, doing some special tests, and using this instrument on your eye. Okay? So I will ensure proper exposure on the head, and I will do hand hygiene. And I will start the inspection by inspecting the external features of the eye. So there is no redness, no swelling, no bruises, no lumps, and no scars around the eye. And for the upper and lower eyelids, they are normal. The iris, pupil, and sclera are also normal. There is normal median and lateral contours, and the duct for the tear ducts, punctum, are also normal. So next, I will start palpating the bony parts around the eye. Please tell me if you feel any pain. I should also compare with the other side. There is no pain. Next, I should pull the upper eyelid up to check for any jaundice, and pull the lower eyelid down to check for any paleness or styles. So next, I should do the Senlin test. So I should ideally stand 6 meters away from the patient and ask him to read each letter from upward to down. If he reached to 20 out of 20, so this is normal. Next, the Ishihara test for the color vision. It's a book that I should show the patient 12 to 15 pages to assess that there is no color vision blindness or color blindness. So now I'm going to assess the patient's visual field. So I'll ask the patient to focus on my eyes. Then I will close my right eye, and the patient should close his left eye. Then I'll put my fingers. I should compare my peripheral vision to the patient's peripheral vision. So from downward until I go to the center. Now the patient should see the tips of my fingers. Now the patient should see the tips of my fingers. Then I'm going to replace my right hand by the left hand, and I will do the same thing from the right side. So now the patient should see the tips of my fingers. Now the patient should see the tips of my fingers. Conclude this examination, I should now start mapping the blind spots of the patient. So I will use an object that has a red dot on its tip, and the same concept of the visual field. So I will close my right eye, the patient should close his left eye, and I should ask the patient to focus on my eye and start moving the object to the left until he can no more see the tip of the object, then I should move it further. The patient should see the object again, and there should be no more blank spots, which indicate the blank spots indicate the position of the optic disc, and should be no more blank spots. Next, I should examine the patient using the ophthalmoscope. So, first of all, I'll ensure the patient is not wearing any glasses and using a dilating drop. And I should, as a doctor, I should remove my glasses if I'm wearing any glasses, and adjusting the ophthalmoscope to my visual defect. And I should stand to the side of the patient. So, as a rule, I should use my right hand if I'm going to examine the patient right eye, and using my right eye. So, first of all, I will check the read reflex by putting the ophthalmoscope into 0 using the middle size lens, and I should be an arm length away from the patient. So there is normal read reflex. Then I should put the lens into 15, and I should come near to the patient using my right hand, right eye, right eye. So I should come closer to the patient to assess the anterior component of the eye, the cornea, iris, and the lens. Then I should reduce the lens to minus -1 or -4 to comment on the retina and its details. So I should now see the ophthalmic disc, which is normal in color. The contour, I can appreciate the contour and its margins, and I can assess the cup to disc ratio, and the vessels are normal and extending to the four margins of the retina, and I can appreciate the macula. There is no hemorrhages or plaques or pus around the macula. And with this, I conclude my examination. Thank you very much.
Assalamu alaikum. I'm a third year student. I was also giving an examination of the cranial nerves. This will include inspection and some tests. So, have your consent?
Yeah.
Thank you. First, I'm going to make sure that the face is exposed and the patient is in proper positioning. Then I'm going to wash my hands. First, I'm going to inspect the eyes for any signs of ptosis which are not present. Then I'm going to look at the pupils to check the size, shape, and regularity, which are normal. Then I'm going to perform the light reflex, first for the direct, and then I'm going to look at the other eye for the indirect, and I should compare it to the other side. For the accommodation reflex, I want you to look at the wall, and then look at my finger. The accommodation reflex is intact. I want you to follow my finger. Okay, the extraocular muscles are intact, and there are no signs of nystagmus. Did you experience any double vision?
No.
Okay, the patient doesn't have diplopia. Then I'm going to move on to the facial nerves. The face is symmetrical. I want you to raise your eyebrows to check for the wrinkles in the forehead, and then I want you to close your eyes forcefully, and then I want you to smile, and finally puff your cheeks. And thank you.